Hi, Elizabeth Wood here from Beyond the Bedroom with another version of Fun Friday Sex Facts to share with you. Today I'm going to be talking about penile transplants. So earlier this spring, doctors at Mass General announced that they had successfully transplanted a penis onto a 64-year-old man's genitals in a 15-hour surgery, and they're calling that surgery a success. On May 8th and May 9th is actually when that surgery was first performed. I want to take you back to the first penile transplant, which actually occurred in China in 2006. While the surgery itself anatomically was successful, the implant caused so much distress for the patient, the Chinese patient, that within 2 weeks the doctors removed the transplant. So that actually wasn't called successful. There was a lot of psychological distress that the new organ created for that Chinese man and his wife. Fast forward now to 2014, December 11th, 2014, doctors from Stellenbosch University, and let me get the other name because it's South African, Tygerberg Hospital in Cape Town performed a surgery, a penis surgery that actually was successful. They didn't announce the surgery's success until the spring of 2015. They were waiting to see how this 21-year-old patient, how he recovered. They anticipated that recovery, full recovery, was going to take 2 years. Well, much to their surprise and amazement, the young gentleman was so far along in his recovery psychologically, from a urinary function, from a psychological function, and from a reproductive function that they announced the surgery as a success. A little bit of a follow-up to that. In June of 2015, they announced that that man had successfully impregnated his girlfriend. So it was the doctors in South Africa that first performed the successful surgery. They had been doing a pilot study as to how to create the best surgical procedure that had been ongoing since 2010. What they studied was facial reconstruction and facial surgeries, and they're using the same procedures, the microscopic procedures, to work with the nerve and let me see what it's called, the nerve and the blood vessels. So they were able to call this surgery a success, which is absolutely fantastic. The young gentleman in South Africa, his penis was lost due to a botched circumcision that was performed during celebration or ritualistic rites of passage that a lot of young men undergo in South Africa. There was one report in 2006 that estimated there were 500 young men in the Eastern Cape province alone that died from that ritual circumcision. So it's big, big news, and there's a lot of need for penile transplants throughout the world, but in specific South Africa, because there are these botched circumcision rites that young men actually consent to. The gentleman here in the United States, he lost his penis due to cancer, and he came out proudly and boldly, hoping to reduce shame around the subject. There are many combat veterans who may need currently the procedure done, who may be on the waiting list. So we can correct doctors can correct this, and they're holding out a lot of hope for the success of this surgery. Accidents, combat injuries, testicular, genital cancers, an infection or botched circumcisions in adult men. Those are all the ways that this successful penile transplant could really change the wonderful longevity and fabulous sex lives and different penile functions that these young men can expect, even older men can expect, now that there have been 2 successful surgeries and hopefully a lot more. So I thought that was a fun and interesting and very, very necessary fact to share with you. I hope you enjoyed. Thanks, and I'll look forward to seeing you again next Friday. Bye. Hi, this is Elizabeth with Beyond the Bedroom. If you liked that video and want to see more, please subscribe to our YouTube channel. You can also like us on Facebook and follow us on Twitter. And as always, please go to our website for the most up-to-date information. Love well and thrive. Thank you.